Many people are first introduced to oxygen therapy during a stay in the hospital. How do doctors decide who may need oxygen after they go home?
Fantastic. So most often oxygen is started after people have had a breathing attack that sometimes we call it an exacerbation of COPD. So let me first start off with what that is, because that helps start these questions about how do you know you need oxygen when you go home? So COPD exacerbations or breathing attacks when someone who has COPD oftentimes is characterized by difficulty breathing, more of a cough, and bringing up more phlegm. In that situation, those are most often caused by a respiratory virus infection, where you have an infection of the airways in your lung. We call those bronchi. So if you have a bronchitis caused by a virus, sometimes it can cause bacteria as well. Or you may have a pneumonia. You may have a full-fledged pneumonia where it's not only the airways that are infected, it's actually the lung tissue itself, what we call the alveoli, the air sacs in your lung get infected, and that's what we call pneumonia. So in those circumstances, your oxygen level in your blood may go lower than it normally is, because now the lung is not able to function even at its whatever baseline state that you are. So when you come into the hospital, one of the first things we do, and you probably have, some of your listeners may have seen this, is that we check your vital signs. And among the vital signs we check is the amount of oxygen in your blood, typically measured first with a pulse oximeter, where they attach a clip to your finger or your ear, or they put a tape over your forehead and measure the amount of oxygen in your blood. They may also do a blood gas. With any of these measurements, if it turns out your oxygen level is low, and by low we mean typically less than or equal to 88% oxygen level, we will give you oxygen. And then what happens typically in a hospital is that we give you treatments that are directly treating whatever the problem is that gave you a low oxygen level. So in some cases, it may be antibiotics. In some cases, it may be what we call steroids, such as prednisone, or some cases, it may be both steroids and antibiotics. And so when you get all of that, we may also end up giving you oxygen as well. We may also give you medications to help open up your airways. So bronchodilators, either via inhaler or via a nebulizer. So those tend to be the treatments we offer for people in the hospital who have a COPD exacerbation triggered by bronchitis or triggered by a pneumonia. Sometimes individuals with COPD exacerbations also have heart failure. They may have other conditions going on, and your doctor and you will need to make some decisions about what else may be going on. How might we treat it? In rare cases, people may also have blood clots. So we may give them blood thinners as well. So essentially, the first thing is to figure out, why are you having a breathing attack, and treating each of the problems you may be having. And based on that, your doctor and you will come up with a treatment plan. In most cases, in nearly every case, these medications work. You will feel better. And in most cases, people go home in 3 or 4 or 5 days after being in the hospital. You and your doctor will need to decide when it's time to go home. And the decisions about when to go home, there's a lot of factors that go into it, but some of it has to do with how you feel, whether you feel better or not, whether you have social supports at home. Is there someone at home that can help take care of you? Because when you get home initially, you won't be able to take care of yourself completely. You may not be able to cook for yourself or clean yourself or do all the other activities of daily living. So based on how sick you are, and whether you have social supports or other comorbid conditions or other factors, you and your doctor will need to make some decisions about when to go home. In most cases, when it's time to go home and you and your doctor made that decision, you may not be back to your baseline. You may not be back to your full normal self. Typically, COPD exacerbations takes weeks, if not months, to get back to some level of normal or near normal. And at that time, your doctor will check your oxygen level in your blood using, again, a pulse oximeter or an arterial blood gas. They may make those measurements at rest, or if you're walking around or during your sleep. And based on all of that information, they make a decision that your oxygen level is still too low to be able to breathe just regular room air. You actually need supplemental oxygen, when you get home. So that's how the decisions are typically made: is, are you well enough improved that it's safe for you to go home. And at that time, do you need some extra oxygen while your lungs are recovering to kind of tide you over until things get back to its normal state? What we've found is that about half the patients who go home on oxygen for the first time can come off of oxygen in 30, 60, or 90 days. Everyone recovers at different rates, but really about half the patients can actually, come off of oxygen. But half of the patients need to stay on oxygen for even longer, maybe a year, maybe indefinitely. There's no way to predict this ahead of time. And really, the best way to make these decisions is to figure out how much oxygen is in your blood, either a pulse oximeter or a blood gas. So I keep coming back to the same thing. We have to measure the oxygen in your blood to determine if you need oxygen, both when you go home from the hospital, but also when you're at home, when you go to the doctor's office, make sure you get your oxygen level in your blood tested. And that's the best way to know if you need oxygen. Don't rely on shortness of breath. Don't rely on cough. Don't rely on phlegm. It's really measuring the oxygen in your blood.